Fast Fridays was developed by the Stroke Reference Group, and we do a national survey once a year, and that indicated that we don't provide education across the continuum of care for Bendigo Health, and it wasn't centralised. So as part of an improvement, we looked at what we could do to improve that education process. So the Stroke Reference Group came up with having a 1 hour education session every Friday, last Friday of the month. And we would provide a range and a mixture of stroke education. So we would get it together across the streams. At that, when we were in the discussion phase, Loddon, Mallee Rural Health Alliance said that they could also video conference across the network. So it now goes out to the whole Loddon Mallee region. So areas like Mildura that traditionally couldn't attend a lot of education now hooks in with us. So we have a range of different education modules that we can do, so different modalities that we can deliver. So because it is video conferenced, it can be face-to-face. There's PowerPoint presentations. They can download the PowerPoint on a website, and they can also access information or articles around it. So we do a range of different things. Sometimes we have stroke survivors talk about their experiences. Other times we've had people outside the organisation who give a session, who have a specialty presentations that we've done at conferences. So it can be a range of different things. The first few sessions we did some feedback, and so the feedback that we got from the other health services was really positive. We also were lucky in that our program was one of the first delivered across the state where we use video conferencing for stroke education. So the National Stroke Foundation in Victoria contacted us to see if they could link in and utilise it. We've had applications from the Austin and Gippsland to see if they could link in. I think the biggest improvement is that some of the areas that have small regional hospitals that don't have many stroke specialists have access, and they know the faces of the staff that work in, particularly the neurological rehab stream at Bendigo Health. So it's done a lot for improving those conversations and who to access to get more information, and we also provide on it the website sites that they can access to get further information. So the very first session we launched it in Stroke Week in September, which is in September 2011, and we had 35 participants, some internal and then others connecting in by video conferencing. The second month we ran it, we had over 90 people link in. Unfortunately, some of them had difficulties with their connection, and so weren't all able to access, but we're now looking at perhaps going to taping the sessions as well so that people can access them at different times. I think it's a need for education in the region. Stroke has become more of a profile, and stroke's something that is, the numbers are just getting bigger and bigger each year, so it is something that clinicians are more aware of, and that they realise that their patients require more specialised treatment. So I think it's a way for them to gain the education without, it's timely, they don't need to leave their clinical area, it's only for an hour, they don't have to travel, it doesn't cost the organisation anything. So it's a really good way that they're able to maintain their education and get the skills that they need without having to leave their health service.